does strategy deployment work within the Lean Management System? Remember that the BC Women's Management System is composed of 3 parts: strategy deployment, value stream management, and daily management. Strategy deployment connects breakthrough goals to the patient value stream for improvement. Strategy deployment connects annual goals to actionable improvement at the point of care. The value stream improvement connects the value stream goals to continuous improvement. We will review an example from the BC Women's Gynae Surgery to demonstrate how strategy deployment works within the BC Women's Management System. The Ministry of Health Service Plan in 2020-2021 established a priority to improve access to surgical services. Here was the goals established in 2020-21. Achieving these goals would require the knowledge and involvement of leaders, staff, and providers at every level of BC Women's Surgical Services Program. The BC Women's Management System was key to help achieve the Ministry of Health goals and targets. Here you can see the cascade of goals and targets at all levels, from senior leadership to surgical services booking office to the gynae OR. Leaders at each level had to know their business in order to determine what they had to focus on and how to contribute to improving access to meet surgical volume and wait time targets. Here you can see the cascade of goals and targets from the Ministry of Health mandate and the PHSA to the BC Women's Surgical Services Program. The diagram outlines the targets that were monitored and reported on by the Senior Program Director and Medical Director Dyad. A performance wall was a tool that was used to track goals and targets located in the surgical suite. The Senior Director and Medical Director Dyad met with the Program Manager and Medical Leader and the OR Supervisor weekly to review goals and targets, understand what they were learning about the actions taken to progress towards achieving the goals and targets, and any issues and barriers that needed assistance from the senior leaders. In the gynae surgery patient value stream, there is a cross-functional flow of work and information between the surgeon's office located in the community and the BC Women's Gynae Surgical Booking Office. The BC Women's Surgical Booking Office requires the surgeon's office to book all assigned OR slates and submit complete booking packages for their patients prior to the scheduled surgery. The daily management board in the gynae surgery booking office was used to track whether slates were booked as planned, whether booking packages were received complete or incomplete, whether creating a surgeon booking pool was effective in reducing patient wait times for their surgery. Here is a picture of the daily management board in the surgical booking office. Visual controls were created by the OR booking clerk to track booking of the surgical slate and identify any issues that needed to be resolved. The program manager, medical lead, OR supervisor, and booking clerks met bi-weekly to review and problem-solve issues. The booking clerk found the visual to be so intuitive and helpful that she created a similar one for elective cesarean sections, even though they weren't in scope for the Ministry of Health goal. The Gynae Surgical Services was a new service with a dedicated team of OR nurses and staff. Daily management was key for the program manager to communicate and involve the team in achieving the Ministry of Health program goals and targets, as well as to discuss and problem solve daily issues that the staff and patients were experiencing. The daily management board in the surgical suite was used to monitor completion of OR slates, early finishes, as well as late starts and discharges. The program manager used daily management to align the goals and targets to the daily work of the OR team. The nurses and staff were able to provide input and document why the OR slates were not being used as planned, reasons for early finishes, late starts, and late discharges. By huddling daily with the staff who do the work, listening to their input, and collecting real-time data about what is working well as why targets were not being met, such as patient, provider, process, and system-related causes, the team was able to design and trial solutions that could address issues that were within their scope, and more importantly, to escalate issues and barriers that needed assistance from higher levels of program leadership.